Mitzi Sackett. Mitzi is with the Cancer Services Program as part of Bassett Healthcare Network. How'd I do?
Very good.
All right. And to tell us something about the health screenings that are available through her program, and perhaps through the rest of Bassett Network. So, Mitzi, all yours.
All right, thanks.
Thank you.
Thanks very much. It's really nice to be here. I love the intimacy of a small group, so I'm really glad to be here and glad you're here with me. So you heard my name, it's Mitzi Sackett. I'm with the Cancer Services Program, and I'm here to tell you a little bit about what we are. I have some fun things here too, so I'll put this up on the chair. Who knows about Cancer Services Program? You don't get to answer that question. Jennifer and I are community partners. We do a lot of events and things together. Anybody know about Cancer Services Program? Know of it? So we are a nonprofit program covered by the New York State Department of Health. We're grant funded through the New York State Department of Health. There is a Cancer Services Program that covers every county in New York State. I'm with the Central Region. We cover 6 counties. Personally, I cover Otsego, Delaware, and Schoharie County. Although yesterday we had an announcement in the office, and it looks like I might cover 6 counties for a while. So I'll be out and about a lot, and it's all good and all very positive because it's a wonderful, wonderful program, and so it was a happy announcement. That being said, I really want to find out, one of the things that Ray mentioned was he's been hearing about wealth being important. He mentioned a couple of things. Those things actually came out of a survey, and he shared that with me several months ago. I can't remember who conducted the survey. There's a lot of data out there that's giving us a lot of great information. And my apologies for, he just slipped out, so I can't ask him where that came from. But 157 organizations and businesses participated in this central New York region and found out that specs on, specs off, you'll get a lot of that. 61.15% of the respondents, and this was amongst executives, managers, and business owners, organizational wellness and learning systems, 61.15% of the respondents are interested in the health consciousness education of their employees. That's a lot, because they're noticing the results of that not being there. So I used to be a health and wellness program director, and I would have clients and go in and create health and wellness programs for different organizations. And what we find is that they're good for business. You know, they bring attrition rate. They make employees happier. They increase employee satisfaction. They decrease employee absenteeism. So I'm going to tell you a little bit about cancer. I'm going to tell you all about Cancer Services Program and why we do what we do and what we cover. But I'm also really here and interested in talking to you folks today about how we can be a part of your business or your workplace wellness program. So I'm going to back up. We cover breast, colon, and cervical cancer screenings for eligible participants. Eligibility is really age 40 to 64, age 45 to 64 for colon cancer screening. And we provide those screenings at no charge for people who are uninsured. So if you have no insurance and you're 50 years old and you've never had a mammogram, we completely cover that screening for you. That being said, and this is a good thing, there are very few small pockets of uninsured people in our state, in our nation at this point in time, which is a plus. So the part that I want to share with my business owner friends is that we also act as a second insurance, and I'll get into that a little bit more later. How many people here, those three cancers I mentioned, breast, cervical, colon cancer, I'm not interested in your personal health history, but how many people here have been somehow profoundly affected by one of those cancers. And anyway, a lot of people, yeah. I have a thing for you. Just a fun little thing that I thought. Who raised their hand? Just a fun, it's like a boo-boo, like a, you know, a cold pack that you put on your,
It'll be well used.
yeah, just to make it fun. I have more for anybody else who wants them, but you know, that was a fun way to engage you and get you involved. So the reason it's important, that screening is important, let's talk about breast cancer first. Breast cancer rates in the nation are 1 in 8. 1 in 8 women are going to be diagnosed with breast cancer in their lifetime. And anybody that knows a little bit about stats, that's an astronomically high number. My personal story, I lost my mother to breast cancer, to metastasized breast cancer. In fact, the reason what attracted me to this position was that my story, just very briefly, back in the day, I got my healthcare needs met at a clinic as a very young person, you know, as a much younger person. And there was a poster in that clinic that said, don't forget your yearly exam and bring your mom too. Now my mom had 5 children. I was the baby. She had me when she was 34. So we're talking about she's in her 50s at this point. And I went home and I asked her if she'd ever had an annual exam, and specifics about an annual exam. And she had not. She had had 5 children and had never had a pap smear. So I told her about the clinic, and I said I'd like to bring my mom too. She came with me, and it was at that visit that they discovered her breast cancer. Her breast cancer was stage 4 at that point. It was extremely advanced. Not uncommon amongst my mom's generation, not uncommon amongst people in general. She didn't really share that she wasn't feeling good. She didn't really share some of the changes that she saw in her body. They were private places that you didn't really talk about, and it felt intrusive to have other people ask you about. So at that point in time, that discovery was 30 out of 30 lymph nodes infected. And I will say that I have no doubt that I probably would have lost my mom in a matter of months had she not known, had she just continued on the path she was on. I actually ended up having my mom another 9 years. And I'm here to say you can do a lot of healing, you can do a lot of traveling, you can do fun things. You can really make best use of 9 years. And that was because we did find it. So that's sort of my personal story and my attachment to programs such as these, because there really is a world or a nation and a state full of people that for whatever reason don't want to be or can't be screened for these cancers. Our agency, our program eliminates some of those barriers like insurance. And another barrier that we also eliminate or try to eliminate, in fact, we have 13 performance measures. We had a very good quarter. We met several of them. We exceeded several of them. The one we're focusing on for our final quarter, as I said, this is a grant-funded program through the New York State Department of Health. It's a block grant, so we're actually entering the last year of our block grant. Bassett holds our grant, and that's what makes us me an employee of Bassett. That's what makes us affiliated with Bassett. There are so many wonderful benefits of being that involved with such a wonderful health network. We get to, we have an amazing mobile cancer screening coach. Anybody seen our coach or seen a mobile cancer screening coach around about in the community? Yeah, people love them because they're like one-stop shopping. It's like a half an hour appointment. There's a clinician on board. You know, you go in and you get all your screenings and boogie out. You're in and out in a half an hour. In fact, right now, our mobile coach is down. It's getting a new motor. So we have people, we also have providers all over that 6-county region that contract with us to provide these services. And they could go anywhere to one of our providers, contracted providers, and in a rural community, many of those providers are already their primary care person. So it works out really well, but they want to wait for the coach because it's very easy, it's very unintrusive, it's a little bit private. So we try to, like I said, we try to eliminate some of those barriers. Cervical cancer, again, I'm telling you folks the why it's so important. Cervical cancer screening prevents cervical cancer. So it's not, so with breast cancer, it's about early detection, right? Breast cancer, it's about the mammogram is gonna detect anything off early, way earlier than anybody's gonna feel it, see it, or anything. That's why we need to get screened for breast cancer through mammograms. Cervical cancer and colon cancer, screening actually prevents those cancers. And I didn't know that when I came into this program. I thought that was pretty amazing. Cervical cancer, over 90% of cervical cancers are caused by the human papilloma virus. I'm sure many of you have heard of it. So having people get in, have a pap smear, get screened, catch changes in cellular structure early, continue to advocate for protection against the human papilloma virus has actually decreased the prevalence of cervical cancer in our state tremendously. Colon cancer, that's the one we're working on. I started to tell you a few minutes ago about our focus for this next quarter is men. We're targeting our prevalence rate of men being screened for colon cancer starting at age 45 is low. And it's a bit heartbreaking because colon cancer is preventable. We are finding it's showing up earlier and earlier. The gentleman's name is escaping me, but from Black Panther. Chadwick, yes. Boseman. Yes. And as sad and as devastating as it is when somebody that's famous receives a diagnosis and loses their life at a very young age, it brings attention. So constantly collecting data. That age that we cover screening used to be 50 to 64, now it's 45 to 64. Depending on the assessment of that data, it might even lower to catch those earlier situations. But it's really, screening is all about finding polyps, right? So when we screen and we find the polyps are removed, they can never turn into colon cancer. So that's how it leads to prevention. Colonoscopies are interesting and understandably some people want to avoid, and that's all figured into how can we remove barriers. We actually, the colon cancer screening we cover is an at-home, it's called a FIT kit, fecal immunochemical. It's an at-home kit. You probably have all seen Cologuard commercials. It's similar to Cologuard, although what is being tested in a FIT is just slightly different. And I always tell people you can do it in the privacy of your own home. You receive it in the mail. You follow the directions. You stick it in the little self-paid envelope, and you send it off to the lab. And what I always tell people is that it's better to know you're good to go than to not know that you're not. And it's a really unobtrusive way to figure that out. If something comes up in that lab result, at that point in time, you will probably have to go on for diagnostics, which will be a colonoscopy. But people who are hesitant, it's easier to say that you don't need one or you don't want to go when you don't know that there's an issue. What the data shows us is if people discover that there's an issue or that lab result comes back, that we need to look in further, they're more apt to go and have that colonoscopy done. At that point in time, Cancer Services Program would also cover that colonoscopy if there was a need. So I've talked a little bit about why it's important in the 3 cancers that we cover. I will say this is just my opinion. I don't have any, I haven't heard anything, nothing's coming down the pike, but I do know I will not be surprised that if in time Cancer Services Program goes beyond breast, colon, and cervical cancer, because first we have to create a screening process that's relatively non-invasive, relatively, and then we have to test it and see if the results of that screening process prolongs life, prevents cancer, and we're getting, those studies are coming back. I would not be surprised if in years, very soon, we start seeing screening made possible for lung cancer, prostate cancer and ovarian cancer, but that's just me. That's just me going down the rabbit hole of data and research because I'm a bit of a nerd. That's not anything official. That being said, what I really want you folks to know about what we also do, not only do we provide those screening processes for uninsured people, we also act as a second insurance for diagnostics procedures for underinsured people. Like I said, my main focus for the last 6 months has been Delaware, Otsego, and Schoharie counties. And what I find a lot, and what I actually had myself in a former employment situation, was pretty okay insurance except a very high deductible. So once that testing goes from screening to diagnostics, in New York State and most of the nation, prevention screenings are usually covered. So you go, and this is a real example of this that happened this summer. You know, you're 50 years old, you go for a mammogram, something looks suspicious. The mammogram is covered, you have insurance through your employer because preventive is covered. But something suspicious turns up. So the medical advice is, you know, we're just gonna watch this. We want you to come back in 6 to 8 months, we're gonna do another mammogram, see if there's any changes. Now that mammogram is no longer a preventive screening. Now it's part of a diagnostic plan. Now it's subject to your high copay or your high deductible. And what the data shows us is that the reality of our world today, of our nation today, is there are just people who cannot afford a $5,000 deductible. And a mammogram is going to eat up a pretty big chunk of that deductible. Mammograms are expensive. So again, this program really working hard to just remove those barriers so that people don't have to, you know, so people can be well cared for, so they can go on for that second mammogram, or they can go on for that colonoscopy if that preventive screening has come up with something suspicious, or even pap smears. You know, sometimes there has to be further diagnostic testing. We act as a second insurance, and we'll cover that. The last thing that Cancer Services Program covers, before I tell you how we can be of assistance in your wellness program, is that we also enroll people in the Medicaid Cancer Treatment Program. I was tabled at the farmer's market in Richfield Springs, and a lady, she kind of kept walking by the table, kept walking by, kept looking at who we were. And usually, you know, I reach out or I stand up and I say, have you heard of the Cancer Services Program? And she said, oh, I know you well. She said, in 2009, I was diagnosed with cancer, and you guys really saved me, because she said, I don't think people realize that when you're diagnosed with cancer and you've got that C word looming in your life, it's hard enough. And then the bills start coming in. And my doctor, my physician, told me about Cancer Services Program, and you enrolled me in the she didn't know the name of it, but it was the Medicaid Cancer Treatment Plan, and you covered the treatment from beginning to end. So we enroll people in that program. You do not have to qualify for Medicaid to qualify for the Medicaid Cancer Treatment Program. It doesn't really have anything to do with that, but it covers treatment from start to finish. So that's the last thing that we provide. So we cover the uninsured, we act as a second insurance for the underinsured, and we enroll people in the Medicaid Cancer Treatment Plan if they need to, if they need that assistance. How it can help businesses and organizations. Back to wellness programs. Get out my fun things again. How many people here have, where you work, or have a wellness program, either in the business that you own or in the organization you work for? And when I ask you if you have a wellness program, it could be once a year everybody gets together and they do a little walking contest, or they perhaps have smoke-free, tobacco-free communities come in and speak to them, or maybe they've made their campuses or their workplaces smoke-free. Maybe you offer an EAP program. And how many people have some type of wellness initiative? Awesome. So here's some. You'll get double. You'll have to take.
You should give them to those who don't have. We need
yes.
some.
I have a whole bag, and you're all welcome to come get them at the end. I want you all to have them.
I think a
So wellness programs, you know, this morning before I came, I shared a little bit about, can you share who did the survey that, I shared with them the results of that survey in terms of the survey that you shared with me? Who was it that conducted that survey? Because I didn't write it.
Workplace Wellness,
Yes.
that was through Southern Tier 8, and LEAF was involved with that, and OWLS, which is a group out in Iowa.
Right. And so executives, leaders, and business owners recognize the need for wellness. Very high percentage, 60-some%. I used to do wellness programs. That was my wheelhouse. And at that time, I used to contract to, organizations would contract to have me come in to design a workplace wellness initiative. And I used to do biometric screenings and all that kind of great stuff. And every year when it was time to redo the contract, or we would contract for a year, convincing ROI on wellness programs at the time was difficult. So sometimes it's hard to convince organizations and businesses to invest in wellness programs. If this morning I went down the rabbit hole of a meta-analysis, because that's just what I do, I'm a bit of a nerd. And basically what they should, we need more longitudinal studies. We need studies that are have a higher level of methodology. But that being said, there's been several thousand done, and a meta-analysis can pull out that wellness programs does lead to a lower rate of absenteeism and employee satisfaction. Because I'm also a professional of organizational psychology, and what's behind that is that it's a way to show your employees that they're valued. So whether that you've made an arrangement with a local gym and you're offering a gym discount or anything, it's just it's a benefit, right? It's a nice little benefit. Where Cancer Services Program can come in and be part of your wellness program is, I gave you a little handout here for the visual people in the room. Pretty much everything that I said in the handout. I all gave you a flyer about what our program is about. We, Cancer Services Program, I'm public education and community outreach. I can come into your workspace and I can tell people about the importance of these screening processes. And I can also, I can do that remotely. I can do an education piece remotely. I can work with you to provide, if you're in a workspace environment where your coworkers, your employees are underinsured and could use that benefit as a second insurance to make sure your 40 to 64-year-olds are getting screened, we can act as that for you today. So reach out to me if anybody is willing to hang a flyer about cancer screening saving lives in your area or in your room or in your workplace, and a tear-off sheet that people can call us. That would be fantastic. I would appreciate that. And you know my name and you can find my number, so reach out to us and we can help you.
Questions?
Oh, yes, I do have one. The Medicaid service that you have thank you. Is that just in this area or is it throughout New York State?
It's New York State.
Okay.
Yeah. New York State. But we are your portal in the 6 counties we cover. Yes.
That's a lot of counties.
Yeah.
Yeah, we have schools, we have 9 employees, and we do offer healthcare, but some have opted out.
Oh.
Because they didn't want to pay, we cover 50%, and some of them didn't think they needed it, or maybe had other options for some. The screening you mentioned, so would you actually, as part of the program, come out certain times of year?
To do the screening?
Yeah.
We don't actually, we've
You
actually,
had
yes, so we're hoping the mobile van is up in January. We're hoping after the first of the year. We have, in fact, a few years ago, we did one at the schoolhouse. We parked the mobile van at the schoolhouse and it becomes a larger event. We promote that event for anybody in the area.
so that could be for the families at the school.
Yes, yes, so absolutely, but we're that 40 to 64 age range. And in fact, I almost forgot to mention, on December 10th at the Southside Mall in Oneonta, we're having a colon cancer screening event. So at that, I'm so excited, we have a giant walk-through colon, inflatable colon. I'm super excited. So,
Right next to the Axis.
we'll have several community partners there talking about the services they offer. We're gonna have presenters there, including I got 2 of my gastroenterologists, our MDs, to come and kind of walk through the colon with you, talk about it. But there on that day, we're also going to have one of our registrants there from the office who, if you qualify for colon cancer screening, you can take the kit home that day. We just send it home with you. So yes, that's a potential possibility. Leave me your information, because when the van is up and running again, the coach is up and running again, we can look at that. But in the meantime, we can also connect your community with participating practitioners in the area and enroll them in the program for screening if they haven't been screened because they haven't been insured.
And tobacco-free communities will be there